Well, good evening, everybody. Allie Baier. I am here with Equipped, and that is the business I run doing physical therapy for horseback riders. It's been a couple years in, and it's just been nothing but pure enjoyment getting to work with the riders and all their different questions, concerns, and coming in from a totally different perspective. So I often find I have a lot of knowledge I want to share, and then usually just a short amount of time when I'm on site with these riders at their farms. So these lectures are going to be really great. We had one a couple months back about breathing mechanics, and then we're going to be doing 4 this month and starting out all about hips. We all know how important it is to understand our seat as a rider, and then from a physical therapist perspective, your center of mass is basically right behind your belly button, right at that pelvis. So both in riding technique and just in how we're built, this is where it all starts. It's very, very dense information. I'm going to try to make it as clear and applicable to riding as possible, but we'll start out with some kind of anatomy and reasonings of why we want to learn about this. And then we'll get into specific strength stretches, balance exercises, and some combination exercises. So really where we're thinking about coordination and putting all those things together specifically for how we will be in the saddle and riding our horses. So Molly, thank you so much for having me. She also mentioned for those that have questions, you can unmute yourself, ask your question, and then feel free to also turn on your video so we can see you and I can have a little visual for asking that question. We're going to do the content part, stop, have some question time, and then get into the exercises, and then of course have questions at the end. So you'll hear me invite some time for that. Until then, if you just really want to get a question in but don't want to interrupt, you can use that chat feature. All right, guys, we're going to dive in. So let's then recap. We're going to do why it matters about hips. I kind of talked about it already. It's the center of our movement as just human beings, and then it's where we often start in our training with riding. But there's some other things we're going to elaborate on. How the hips work, how do we actually get them stronger and looser and more balanced? That's going to be the exercises. And then at the very end, I'm going to get into some real specific examples of integrating this into your riding. So that'll be the when. And then we have, I'm going to just mute. I hear just a couple things rustling, so I'm just going to mute those other than me. So we are set here. And then let's just get into a little piece of what I call some empathy towards ourselves. What we do today is going to be doing a whole new kind of reference about how our brain and our body connect. You have tons of experience of moving your body by this time in your life and by this time in your riding experience. And every time we learn how to move, our brain writes a little book, puts it up on a shelf, and every time we need to do that movement, it grabs that book and it goes, oh, this is how we do it. Those books, those movement patterns, even the ones you really didn't want to write, like let's say you hurt yourself and you had to limp around for a couple weeks, or you were taught something one way and now you're trying to unlearn it. Those old books stay on the shelf. And this is something that physical therapists know very, very well. And so we are also aware that if we choose new books, we teach someone how to write a new movement pattern. It's also really important that we understand as the participant, when am I going to that old bad habit? How do I know I'm doing something wrong? And then how do I know I'm grabbing that new book? So I tell this to people because you're going to learn a bunch of new book content ideas. And you're going to be like, great, writing down, boom, in my brain. And then you're going to get on your horse and you'll be like, oh, I'm doing that old thing again. That's okay. That is where we got to just be really patient with ourselves and have some empathy for just how our brain and our wiring works. Hopefully those that are new in the game of riding are kind of getting good instruction. And this is something that I do feel very passionate about. There is no young enough age that isn't appropriate for getting in some good quality experience with the work I do and the knowledge I have. So let's dive in. Some of the why we care about our pelvis so much. It's really the connector of the right and left half of our body and the top and the bottom of our body. It's sitting in the center of our mass. And if you look at how we sit on the horse, it connects the hind end to the front end. All that impulsion and all that power that you're getting from the hind end goes through you as it passes through the horse's spine and rib cage. And then you decide and direct and influence what it does through the front of the horse. So it's a really big messenger system. As you look at your upper body and lower body, how we sit in our pelvis, and this is a very easy thing. I know I'm going to change this a little bit, but we also know, like, if our pelvis tips forwards, now I have an influence all the way up the spine, whether that's going to be tension in my back, headaches can start to begin. There can be increased arm tension as I'm off balance, gripping. So we know that a pelvis can go up and impact our riding quite a bit. But I'm also going to point out today in a couple different ways how the pelvis is going to influence knee position, ankle position, both in the saddle and out. So as a physical therapist, not treating horseback riders, for about a decade, I was in just a traditional outpatient clinic. And I can tell you that no matter what the diagnosis, pretty much other than elbows and hands, I could find a way to always bring it back to the pelvis, whether that was headaches, shoulder pain, knee pain, ankle sprains. There was always some sort of dysfunction in those clients within their pelvis. And that's because it passes influence up and down. And then, like I said, it connects the right and left half of our body. It is often very tight. We know this because we sit and we, sit to eat, sit to drive. Even if you don't have a day-to-day life job where you're sitting, we still find ourselves in that position quite a bit where we are flexed forwards. And then we get on the horse and want to be this tall and open and elongated being. I also want to just plug right away now that just because muscles are tight doesn't mean they're strong. In fact, tension and weakness often go together. So we're also, as we get to the end of this talk and do these combination ideas, that's really where more and more of the physical therapy research is going, which is let's loosen muscles through movement. So we're going to do some great things for that. The hip position, it's really important that, we don't go, okay, I got to do this and this and this and this and hold. Okay. It is needing to be a fluid following seat. And that really is the artistry, I feel, of our athleticism as horseback riders. We're not just simply strong, but we're highly reactive and can feel through our seat. Probably the most out of any aid we have, we feel through our seat. So following and having that ability to receive information and subtly adjust our balance, or maybe not, so subtly. If a horse is spooking, that is going to be a big time where we just need all the power that is around our pelvis and our hip musculature too. So we get all of that in that type of athleticism. And as I alluded to before with my past care out of the horse world, that pelvis and how it sets the stage for your limbs to leave it sets the stage then for where our kneecaps point, where our ball, I should say the ball and socket joint of the pelvis swivels. So then the knee swivels to reflect that, and our arches rise and fall to reflect that too. So if we can really anchor our pelvis, our knee and our ankle becomes quite protected and reinforced with some of its stability. So this is a great time of year when we have like potholes in the driveways, we have ice, we have really junked up paddocks, and there we go walking through it. So I really do mean off the horse, this is important stuff, in particular with all the uneven groundwork we do. So hopefully, hopefully I've baited you guys enough to keep your attention onto what we're going to be doing next, which is going in through some anatomy. I'm going to grab one thing. And this little, I know I have the big picture up on the screen, but this little pelvis, if you look on my screen, you can see just in the context of how the spine comes down, these little yellow offshoots are nerves. That's not on the picture on the slideshow, but I just wanted to point out all those nerve tissues for some future content we go over. And then this is the front view. This is what you see on the screen. The pelvis is a big bowl. So here's the circle, here's that bowl. You have a right half and a left half, and it joins together at the front through what's called the pubic symphysis. That's actually a joint. It moves just a little bit. It has some play. It has a lot of play for females in the process of pregnancy and labor and delivery. That's why it's there, is so there's a little bit of play and flexibility of that pelvis. But it also can become a little bit off kilter. Just when people say like, oh, my hip is out or one hip's higher than the other, I often think this front pubic symphysis, or this front joining together of the pelvis, gets ignored as well in terms of potential sources of pain. Your abdominal muscles connect there. So the activity and the capability of our lower abdominal muscles also needs a stable and even pubic symphysis. Then the back view, which has this triangular sacrum. On the very, very bottom is your tailbone. And then that sacrum, it's 5 fused bones together. So when you're itty bitty, they all kind of move freely and independently, and then they become fused. And that tailbone, if you will, can sort of change angles. It's part of what needs to follow the horse's movement. It's tiny movements though, like just a couple degrees, not as much movement as the actual bowl of the pelvis would move with the horse's rhythm. So those are the big things I wanted to point out about the pelvis. And then I also want to say, when someone says my hip hurts, I, the physical therapist, am thinking about this ball and socket joint, this very movable joint. It's at the widest point of our pelvis is where that hip joint is. And then the pelvis is the bowl I alluded to, but I can't tell you how many times people come and they're like, yeah, my hip really hurts. Like, oh, my hip hurts. And I'm like, that's your lower back, or oh, that's the pelvis. So let's be really clear here. Our talk is going to be about the hip joint and the pelvis and the sacrum. But it's important in localizing your anatomy to really figure out, what do I do here? Do I do some of the stretches Allie mentioned for my hip? Do I need to go into some core work? Do I need to think about care for my lower back? All those things kind of blur into one experience of our pelvis and surrounding joints. This ball and socket joint, I'm going to add, it is the strongest joint of the whole entire body. It's the deepest socket. So the pelvis, the bowl, has a carved out socket, and then this thigh bone inserts into it. And not only is it just a really deep socket and a very, very strongly attached through ligaments and capsule, which is another type of connective tissue, it then all has this massive tissue and muscle around it. So it's super, super rare for hips to dislocate unless there's like the genetic hip dysplasia predisposition. Unfortunately, hips usually just break. They don't pop out of socket. They just ka-chink, break. So when you think about, man, like the body can go through some pretty extreme experiences, and that ball and socket joint is still together, that's almost setting a bit of a conceptual stage for us to understand how tight this area of the hip joint, the ball and socket joint, can be. So it's not like one quick 10-second stretch is going to be enough to really dramatically change this ball and socket joint. It takes a lot of repeated effort to really have full flexibility there. it moves in 3 planes. So I'm gonna, rather than getting too complicated on this tiny little picture, front to back, it swivels in and out, and then it goes out and in. So let me show you that on what I'm doing here. So we have front flexion, and then we have going back, that's extension. From the front view, we can cross in, that's adduction, like ADD, I'm adding up math. And then abduction, like abs, like our core, abduction. So coming in and going out, going to the front and going to the back. And then this I'm going to show you with my knees assisting a little bit. So if you think about where my kneecap is, I can swivel and turn my kneecap in like I'm going knock-kneed, and I can swivel and have my knee turn out. And of course, my foot is following that. So this is internal rotation, and this is external rotation. And of all the movements of the hip joint, this, to me, this in and out, is the most underutilized from horseback riders. It's just my mind just gets so excited by it when I get to work on it with riders, because there's so many ways that internal and external rotation changes how the leg aid is applied. We'll get into that later, but I just wanted to point out those 3 planes of movement, and that rotation is just the most juicy, rich content for riders. So let's see, I think I talked about all that big pieces, joint-wise, bone-wise. Every joint has ligaments and a bunch of fascia that connects all the musculature. There's cartilage, there's labrums, there's disc material. So there's a lot of other non-bone things that live in this area that aren't quite relevant to what we're going to talk about today. But certainly if you had a distinct injury and damage to some of those non-contractile tissues, meaning not the muscles, but all the other stuff, that is certainly something you're welcome to ask me about on a one-on-one basis after this. Okay, I'm going to have us do a little palpation. So that's a fancy word for finding it with our own fingers. And that's going to let us experience some of the borders of these muscles. The front muscles, I'm actually going to have everyone stay sitting for this part. So you're going to find the outside pelvic bowl, and then your fingertips, where they kind of naturally come and meet to the front of your body, is usually where this sort of edge of your pelvis, the pelvic bowl, starts to drop down. Pelvic bowl, do, and then it drops down. There's this little kind of knobby prominence here that we're all aiming for. So you're following your belt line, and you feel this drop down. And it's at that prominent edge, if you can see my mouse, I don't know if you can see my mouse, but that is where the junction of your hip flexor muscles comes out of your abdomen into your thigh. And that's also a connection point for the start of your quad muscles. So we're using this as a reference point. If you dive really, really deep, like you're poking directly back to behind you, and you can move your intestines out of the way, you would get to your hip flexors. This is really hard to palpate on yourself. You can do it depending on kind of how much tissue is here on every body type. But if you go all the way back, all the way back to the posterior wall of your tissues, that's where you would run into your hip flexors. In the picture, you can see right next to the spine, they sort of parallel that spine, your psoas major. And then your pelvic bowl, the lining, the inner lining muscle of that pelvic bowl is called your iliacus. Those two come together. So your psoas and your iliacus, they come together and form a tendon about right at that knobby place that we felt at our pelvis. And then they go and they attach to the outermost wide point of the hip. So if you look at me, I'm tracing these hip flexors from belly button out to the widest point of the hip. Just check out the surface area of that. That's really big. I don't think these pictures give it justice, just how big this muscle is. It's not just some tiny little muscle right here. It is belly button to widest point of your hip. Hip flexor on the right, hip flexor on the left. So that's your hip flexor. I realize it's hard for some people to go all the way in and find it, but that's where you would feel it as we get into some stretches and such later on. Obviously our quads, you know, right here, big quads. That is a very dominant muscle in the work we do. And now if you put your hands here and here, where your thumbs are is a rough border where outside of that would be your quads. Inside of that would be some of your inner thigh muscles. We call those as a group your adductors. Why? Because these inner thigh muscles adduct or bring your knee inwards. So think just squeezing in against the saddle. Those would be adductors. So a very, very highly used set of muscles for equestrians. Admittedly, when I was very, very active in riding, I don't think I ever stretched them once. Like when I was in my teens and young 20s, it was just like ride, 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 go, go, go. And I can't tell you how much they were neglected for how much they were used. So just as we get to stretching them today, hopefully this is not foreign to you guys, but if it is, just wow, what a great, great set of muscles to have some awareness of for riding. So hip flexors, quads right on the front, and then kind of from that thumb placement in would be your adductors. I'm pointing out a tiny little muscle that on this picture, they don't actually have it labeled. They call it the iliotibial tract, meaning there's a small muscle that turns into the connective tissue of your IT band. So there's a tiny little muscle called your tensor fascia lata, TFL. And for all intents and purposes, it is sort of that faded red muscle. And then it turns into a big giant strip of strong connective tissue called your IT band. Why is your TFL important? I'm going to have us stand up, and then you're going to feel this muscle. And then we're all going to kind of go like, aha, yeah, that's how I would use it. So hands on the widest outer point of your hip. And if you can have your wrist by that pelvic bowl, by that bone, and then where your hands drape down, directly on the outside would be your gluteus minimus, and then roughly where your thumbs are, so just a little ahead of your midline, is where those TFL muscles are. I'm going to have you turn one foot in and lift your leg up and forwards, like on a 45-degree angle forwards. And this little muscle where your thumb was should sort of pop up right underneath you. It's a tiny muscle, but man, is it mighty in lifting your whole entire leg up and away. So when we're riding, our leg is slightly ahead of us. And if we want to take our leg off, open up space for the horse's rib cage, or just, you know, try not to pinch our knees, we are using our TFL right here. A lot of people overuse their hip flexors on the front, and they underuse their TFL. I mean, just, it's fair. The hip flexors are really big and mighty and overused at times. But that TFL is part of opening up our leg pressure. It's an anti-knee gripper. It's opposite of all those tight inner thigh muscles. So your TFL, it's kind of on the front, kind of on the side, but in this picture, again, they call it that iliotibial tract. From the back view, our big gluteus maximus is on the back. It gets all the credit for all that like push power that we get from our posting or squats. Your gluteus maximus obviously is really important for propelling you forwards. On the back of your thigh are your hamstrings. We're going to do that same sort of hand width for hamstrings, and then you're going to find that some inner thigh muscles are snuck back there. So if you put your hand, you guys can stand, or I guess you could do it sitting, but it's going to be a little easier standing. If you put your hand on the back of your hamstring, where your pinky is roughly the stop of your hamstring and the start of your inner thigh. So then I have about a third of the mass of my thigh. So hamstrings, where my pinky is, and in, if I go from thumb in, and I connect that, well, now I'm just grabbing all my adductors, but that's a huge amount of tissue. It's not just the front quads and just the back hamstrings. A third of that are your inner thigh muscles. So I just want to point that out. This picture on the PowerPoint just has the hamstrings. If we were to peel those away, you'd start to see some of the insertions of, and the attachment points of some of those inner thigh muscles. Your hamstrings, they bend your knee like a hamstring curl. They really don't need to be that active in riding. We don't need our heels coming up. We don't need gripping and tension at the back of the knee. But they are helpful in decelerating some of our motion. So in riding, I don't think I need I don't ever really give out hamstring strengtheners for people. And most riders are pretty quiet with their hamstrings. And so I also don't feel like they're chronically tight. It's the people who are super fit and active outside of riding that I'll run into some of these hamstring issues. So we're going to now move to the pelvic floor, I think. Yeah, okay. That's where the other ones are. So we did front, we did back. If we look from a bug's eye view, so this is looking up underneath the human. This is the pelvic floor. We get to dive into this in a whole lecture coming up this month about the pelvic floor. So I'll be really brief today, but I can't highlight enough how fascinating that next talk is about the pelvic floor. So it connects the right and left seat bones. So the two little seat bones we sit on. Just imagine all the muscles going from one seat bone to another. Of course, it has openings for all the bowel, bladder, and sexual function that occurs at the pelvic floor. But it also has muscles that go transversely and obliquely. It has muscles that go front to back. So we have a huge web of muscles that are part of that messenger from the right to left half of us. And where I think this is really interesting is when I look at someone and it's like, okay, their pelvis is level. They have roughly similar strength, right and left side of their hips. But why is their right leg just so much different than their left? And I'm trying to kind of dig into maybe less obvious reasons for asymmetry of the right and left half of the pelvis or the right and left leg control. It's usually in the pelvic floor that I find like, oh, wow, okay, they have a huge trigger point on the right half of their pelvic floor muscles. Maybe this is a, middle-aged woman who, through pregnancy and delivery had some tearing or scar tissue. Maybe this is a site of just a high amount of tension in any age of person. So this is a really interesting place where we can influence the musculature of the hip. Some of the rotational muscles live in the pelvic floor and go out and attach to the hip joint. So it's kind of an interesting way of treating hip motion by treating the pelvic floor. And then also, like I said, it is highly connected to tension, anxiety, nervousness. That is also then correlated to how we breathe. So we'll get into that more in the pelvic floor talk. And then in our breathing lecture, we just touched on it a little bit as well. But again, fascinating place we rarely think of. These are the last two views. On the left, these are the inner thigh muscles I talked about, your adductors, or what one might call your groin muscles. So they do go very high up, kind of on that bikini line, but then they have attachments all the way down all the way down to your shin bone. That long piece of tissue that goes all the way down is your gracilis, and that's kind of the most, if we feel this on ourselves, it's just like the most strappy feeling thing. It feels kind of cord-like. And then when we go inside of that, it's a little bit more like the rest of our thigh, just sort of some softer muscle tissue. So there's 5 muscles there total. They can, trigger points, tension spots in the inner thigh can refer pain down to the knee, and they can refer up into the abdomen and into the hip. So it's a really interesting place in terms of a pain generator, up at the groin and down to the knee. And then it ended up being that it was in the middle, right in those inner thigh muscles. So the last picture for muscles, and then we're going to stop for questions. So start thinking if you have any. The TFL is shown on this outside picture. You can see that TFL, and then it's kind of all misty white because it's highly connected with fascia to your IT band, which is a huge, strong strap of tissue. IT band stretching is just kind of comical because there's no way you're stretching it. You can mash on it with your hands, you can roll it, you can do all kinds of aggressive soft tissue techniques, and that strap there, not to be morbid, but back in PT school in our anatomy class with cadavers, we could literally put our hands under that IT band and you can lift the entire weight of the cadaver and that band isn't budging. It is like a strap on a suitcase. It is super, super strong. However, you can see in front of it are the outer aspects of your quads, and behind it are the outer aspects of your hamstrings. So I do think when people do roll them or have massage work done and say, oh, my hip feels better, my knee feels better, you're really just influencing the outer quad or the outer hamstrings, or loosening up the fascia that just allows for that whole entire thigh to breathe a little bit more. So I'm not saying don't stretch your IT bands, but I might just say I'm going to be rolling my outer musculature, or I'm going to be releasing some fascia to just be a little bit more true to what's actually going on. This is also the view. So we're going to go back to standing and having our hand on our outer hip right at midline. Our thumb is on that TFL. And then where the my main fingers are here of my hand, that's where my gluteus minimus is and my gluteus medius. So minimus, medius, and maximus. And more towards your pinky is where you're going to run into your medius muscle. And why that is so important is because it not only takes our leg out and away from the saddle, but it's also an external rotator. So it specifically is the most powerful at rotating our knee away from the knee roll and lifting it off. You know, the whole entire thigh and calf could come off using your minimus and medius. But that medius muscle is really important for opening up knee pressure. Also, when you stand on one leg, it's your minimus and your medius that keep your pelvis level. And if I were to tell you the main way I see gluteus medius weakness in riders, it's actually through someone whose pelvis is off or they're leaning. So if you're someone who you're like, yeah, I know I always tip to one side, at the pelvis level, that almost always is coming from weakness of these outer hip muscles, gluteus minimus and gluteus medius. I think that's all I want to say about the musculature, just to give you guys a sense of reference. As we go to strengthen these and stretch these, I will remind you where you should be feeling them. But let's stop and pause and see if there's any questions on the bony anatomy or any of the muscle anatomy, pelvic floor, why we're talking about it, any questions that we want to cover. before we dive into a little bit more. I don't understand that last question that was posted on the chat. Sorry. And any others, you can also unmute as well and speak. Okay. We're going to then dive into the range of motion. This is just kind of like the nitty gritty stuff. If you wanted to be really, if you're like a sucker for numbers, if you will, let me move this here. When you bring that knee to your chest, just sitting is 90 degrees, and then taking it as far towards the front of your chest as you can. Again, depending on your body shape and composition, you might just run into your abdomen. But also there's a stop point, that ball and socket joint. Eventually the ball runs into the socket and stops, and it's at 145 degrees that we see that. We need 120 degrees to be able to squat down and pick something up off the floor. If we have 145 degrees available to us, then we can kind of, what I say is we can squat down like a catcher in a baseball game. But for the most part, all we need to do is reach something from the ground, and we can get that done at about 120. Think about putting on your horse's boots or polo wraps, whatever kind of foot care you might be doing. That's the type of motion that we would be using most of our hip flexion for. And then what we'll also consider is going into, oh, I have a little typo. I have flexion twice. The second time it's written, it should say extension. Extension being the opposite of flexion. 10 degrees, 10, it's tiny, it's super tiny. So here's the ball of my hip joint. 10 degrees is, if I measured down to where my knee is, 10 degrees is about like that. Now, getting my leg back further than that is going to start to involve my pelvis tipping or my lower back arching. But 10 degrees is tiny, real tiny, compared to all the movement we have into flexion. The in and out, so abduction, adduction, same thing, about 55 degrees. So you can picture a 45-degree angle, and then just a little bit more would be 55. 45-degree angle, a little bit more would be 55. We don't find we use the extremes within riding. The internal and external rotation, I'd like everyone to do this in sitting, since probably most of us are sitting. Actually, let me just sit on my table. If you think about your shin as the angle maker here, we're going to do, let's do internal rotation first. So everyone put their hands on their right thigh. And you're going to imagine twisting that thigh inwards. Notice my foot goes out. So internal rotation of my thigh moves the foot out. And we should be able to get 45 degrees. So you can kind of, most people can picture or feel 45 degrees. Curious if anyone's getting like a cramp or a Charlie horse as they do that, because these are muscles we don't often use. So be kind to yourself. Don't like push it or twist really, really hard, but 55 degrees. And then go to your left leg, swivel in, and see if you can get that shin out to 55. Now, I have more than 45, 45. I have more than 45, so I'm going to try to be like realistic here, but I can go more. It's not good. It's not like I'm a better person because I have more motion. In particular, I don't want that much internal rotation. 45 is all we need. But now external rotation, let's go back to the right thigh and swivel this out that is where we want beyond the 45-degree mark. This is where you got to be careful you don't cramp up. Your inner thigh muscles or your hamstrings will really try to recruit this quite a bit. So often I'll have people put, like, Mr. Rogers putting on his shoes, this type of setup where you're having some passive support. And then you can get a comparison of how high this right knee is compared to how high this left knee is, just at rest. If one of yours is like way up here, you're probably a little bit tight and limited in your external rotation. So again, you can do it just actively like this, but most muscles are gonna go, whoa, 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 we can't do this. So then just pretend you're putting on your shoes, relax this knee down, just see what happens at rest, and you can compare the motion from right to left. A lot of times we have a difference in this type of movement, this rotational movement from right to left. If it is a joint stiffness or a muscle stiffness problem, we go about managing that a little bit differently. So I just want to point out like what it means to have joint stiffness versus muscle stiffness. The ball and socket joint that I mentioned, big strong joint, all those directions, every time let's just use like flexion, bringing your knee to your chest, for example, every time that joint rolls up into that flexion, it also glides back. So I'm going to show you that again with my hands here. Every time that every time that ball rolls forwards, it also needs to glide back. And that roll and glide are exactly what physical therapists hone in on. When we grab somebody's body and are feeling for joint motion, we're seeing how much can that joint glide? Front, back. How much can it glide in and out? How much can it gap? And these are all tiny, tiny little motions that we're feeling and assessing on literally every joint of the body. And then we can go and just stretch them. The hip is phenomenally strong. So this is where I'll kind of use like a belt around me and around the person. And I actually use almost my whole sitting body weight to stretch this joint. But it's really interesting because I find so many people are like, oh, my hip, it's so tight. And I did my piriformis stretching and I stretched my hamstrings or I roll my IT band, and they're addressing all the soft tissue problems, but they're not actually having anyone coming and assessing the joint motion. This is where I'll also point out chiropractors work on joint motion as well, especially of the spine, and some do adjustments to shoulders and hips and ankles, which are very quick, kind of low force, but high speed. And physical therapists are coming at it with slower speed and a little bit more specifically in every single direction each joint needs to healthfully have. And then we say, great, now, rider, I want you to use these muscles as I'm doing the glide, as I'm applying that stretch. And we're starting to write that book, the new book about how to use the joint motion as we're giving that joint motion to the person. So totally on my PT soapbox, I think we are by far the most specific and most thorough profession that addresses joint stiffness. And joints just get tight when you don't move them through their full range all the time. They get tight, like I mentioned, from stagnancy, like our sitting postures. But again, if you just never have thought to use hip rotation while you ride, and now you're going to go and you're going to try it, you might go, I don't have all that rotation. So even seemingly loose, flexible people can have some tight joints as it comes to those little glides. How do you know you have a joint that's tight? It usually has a pinch. I can't go any further. There's no more motion because I'm getting a pinch of bone to bone, or I'm pinching the cartilage, or I'm pinching a ligament. It's very specific right to the joint. At times it can feel like an ache that goes down the thigh. If you have a tight hip joint for, months and months and months, it can start to radiate a little bit. but as you move, it's going to feel like a short, abrupt pinch. If a muscle were tight, you'd feel a pull or a stretch versus a pinch. So if you feel pinching, definitely chime in with me, because that joint motion is usually the culprit. And then you're going to stop wanting to stretch because it actually hurts and makes things worse. Okay. Go ahead.
There's a question here in the chat. How does age affect the glide of the joint? Is it lost or can you regain it?
Is everything lost as you age? It's a really good question. The potential for normal, healthy joint motion is absolutely still there all throughout life. However, arthritis is a little bit of a hitch in some of that, because what's gliding is the ball of that thigh bone has smooth cartilage, and then on the inside of the socket has smooth cartilage. As that cartilage potentially thins and becomes non-existent, or you get roughening of the bone, then the glide, while it's still there and there's still a potential for it, it just hurts. It becomes an inflammatory experience for that joint to have a lot of glide. So what I do every time I apply glide to a joint is I first create a little distraction, not like attention distraction, but a little gapping, a little opening. So when I do glides, I'm not going cartilage to cartilage on anybody. That's all ages get that type of stretch. But it is a way that someone who has some beginning stages of arthritis can still receive the glide and the healthy movement and sort of that input into their brain to try to keep the good, healthy movement. And you just keep it as much as your pain allows. So age shouldn't be a factor to not have glide, but if you have some advanced stages, moderate to advanced stages of arthritis, you just won't find you use your joint movement as completely because of pain. Any others? I'm trying to get my chat thing to pop up and I just don't see it at this time.
There's no other questions right now.
Thank you. I won't keep trying to make it pop up. One last thing I'm looking at my notes here. I forgot to mention something kind of interesting. As we get into doing these stretches and strengtheners, one might argue what's more important. Like, is it more important to be stretching, or I only have 10 minutes? What should I do? Should I stretch? Should I do a strength exercise? There's a lot of research that's really digging into the specifics of the equestrian field. And a great study was done in 2020, so relatively recently too, which looked at a bunch of the youth rider population. And then they were looking at, was it strength, range of motion, balance, like meaning symmetry, like how even are the right and left halves of someone's body. So between strength, flexibility, and symmetry, what was the most important key thing to have in place to avoid lower back pain? And we'll talk about how the back and the hip are really highly connected in just a minute here. But I thought this was great because we're trying to preventatively look at what should we care about the most in the limited time or attention we have for this. And they found that even more so than, say, a difference in leg length or tight hip flexors, it was actually the outer strength to do a side bridge. So this right here, one might call it just a side plank, but they called it a side bridge because there's a bend at the knee. Someone's ability to do that, so their stamina of their outer core and their outer hip muscles were the number one predictors of a lower back pain incident. So if they couldn't hold that outer hip and core strength, that they were at a really high risk for lower back pain. more so than the people who were crooked and more so than the people who were tight. So strength is going to be really important. But before we get there, I am starting with stretching. It's not that stretching isn't important. It's just that of all the things, that was the biggest predictor of future pain in these youth athletes, so under the age of 18. Which it's really unfortunate to see that there's such a prominence of it that it's been researched. But, you know, I'm sure all of us at one time or another have had low back pain. So let's dive into some stretches. And then Molly, that was helpful. Just interrupt me if there's a question on chat that I should address. But we're going to stand up and using your chair that you were on, or if you're by, you know, a couch or a desk or something, feel free to have something available for your balance.
Excuse me, there is one question here, and that is, was the research just for equestrian youth or sports youth?
No, just equestrians. So there's 3 studies I'll talk about in tonight's talk. And then on my second to last slide are the citations for it. So there's actual real deal, just horseback rider youth. It's great research. So we're going to stand up and we're going to stretch. This is great. We're about at the halfway point. So, a great time to stand and stretch anyways. So this lady in the picture is somewhat showing us what our first stretch is going to be, except there's a big giant red X that says, please don't do what she's doing with her lower back. This is my reminder, because we're going to go into, in a couple slides, into the aspects that your hip has at preventing lower back pain. Those hip flexors, which is what this stretch is trying to do, they attach to the bottom 5 segments of your lumbar spine and then go down and out to the hip. So when I'm stretching in this position, yes, I might feel it on the front, but I actually wouldn't mind if someone were feeling it kind of up into their deeper parts of their abdomen. And a stretchy, flexible, pliable hip flexor muscle allows that lumbar spine to move and follow in the saddle. So unlike this lady in the picture, we're going to have our hands on our pelvic bowl, and we're going to ensure that the front and the back part of our pelvic bowl are level versus tipped forwards. So level. And then I'm just realizing you guys need to see my feet a little bit more. So I first set this, and if you set your pelvis to level, that should already slightly produce a hip flexor stretch for most people. If it doesn't for you, then get your feet further apart. But level pelvis in this lunge position. And then I'm going to stay totally vertical in my spine. And then I can shift my weight to that front knee to intensify the stretch. Again, please be aware that you don't like start tipping forwards and have that over curvature of your lower back. Some people might also feel this going down the front of their back thigh because it's your quad that can start to get some of that stretch too. You can switch sides and then get a nice comparison about just which hip is immediately more tight sensed, has a tighter sense to you. Usually one is tighter than the other, usually, not all the time. And then from the front view, I'm going to show you how we're going to try to start to feel it coming up through our abdomen. So whatever leg is your back leg right now, take that arm up and over. And you might feel some of that stretch reach into the lower abdomen. And that we'd have to switch. That comparison, again, you might feel more in where that hip flexor muscle tissue actually lives. That's like a comparison that I think is actually pretty interesting, is maybe you feel one really high and the other stretch kind of low. So maybe not just intensity of stretch, but location of stretch could be a little bit different. We're going to take this to the inner thigh muscles in a side lunge stretch. What I think people can really appreciate with this is how much of that thigh are your adductors? So if I do this stretch, so I should demonstrate, we're just going to take a side step. I'm going to sit back and lean to that bent knee side until I feel a stretch. To be kind to your bent knee, please look down and make sure that that knee isn't going over the toe. It's got to stay back behind that toe. And as I'm feeling this stretch, if you watch my chest angle, the lower I go, the further posterior I'm going to feel that stretch, meaning towards the back of my thighs. And then the taller my body is, the more anterior or the more forward those inner thigh muscles will receive their stretch. And if I'm kind of like on a 45-degree angle, then I'll feel it in the middle section of my inner thighs. We can switch sides. And then here's the fun part about comparing. Not only like on one leg, do I feel it more on the back, in the middle, or on the front? And how does that compare to the other side? For example, you might feel it on the posterior side on my one leg, and then I feel bigger stretches on the front fibers of my other leg. Or maybe I feel equal on both sides. Maybe they're both really tight. The duration of hold times is a highly researched and contested thing in all kinds of, personal trainers, athletic trainers, and for physical therapists. So these are called static stretches. You want to hold these for about 20 to 30 seconds. And they have kind of average research support that they can prevent injuries, but really are helpful from the backside of exercise to make sure that you are sort of giving the proper recovery experience to muscles after. So, should I do these before riding? Sure, it wouldn't hurt. Should I do these after riding? Yes. I see we have a raised hand. Go ahead, you can unmute.
So my question is, when you have the one knee that's bent, the leg that is extended out, are you keeping it straight? Are you turning your knee in? It's so totally straight.
It's just totally straight. Yeah,
Okay.
we don't have to add any swivel effect to it. The way you're changing where your fibers get stretched is by how low or how high your upper body is leaning.
Thank you.
Yeah, good clarification. So as we are stretching muscles, 20 to 30 seconds, you can do them before, but once that muscle's been used and warm and active, you're going to get a more effective stretch after that activity. The next one, a Z sit, I'm going to do up on the table. And this is where, again, without knowing everyone's age and abilities, please be kind to yourself on this one, because this is really getting at the ball and socket joint to stretch at the level of the joint. So a joint stretch. You're kind of really rotating and moving that ball and socket joint to its end range ability, so that when you move and do everything you want to do with riding, you have all that mid-range flexibility. So we're going to the end range of motion, meaning we're going to feel some pressure at our joint. It should not be a pinch, but it should feel like a very distinct pressure at that crease of our at our hip. So you'll need to be on the floor. I'm going to give everyone just a second to get to the floor. Have space for that, and hopefully still be able to see the screen. But it's going to look like one leg tossed out to the side as the other leg, you can choose which one's which, is crossed down in front of you. So one side of you is sitting crisscross applesauce, and then the other side of you has this leg out and off. I'm going to call this tucked under leg our leading leg, and then this one that's behind us, the trailing leg. And our leading hip is fully externally rotated. And our trailing leg is fully internally rotated. So they're doing opposite things. If you are able to, like some people have such tight hips, they can't really balance without having a hand on the floor. But if you are able to, you can try to sense how close to being level are my two halves of my pelvis. A little angulation, a little bit off is okay, but something like this, you know, where I don't even have one butt cheek on the ground, that's a pretty tight trailing joint. So a pretty limited internal rotation on your trailing leg. Then there's also people whose leading leg, their knee can't really reach down. You know, it's kind of hovering off the ground, and that would be limited external rotation. Just being here without any hands is a great workout and a balance technique for your lower core and pelvic floor muscles. So I know I'm sitting here making it look pretty simple, but it is not always that simple. So I can only imagine there's some people on this talk maybe a little bit limited. To be fair in how we assess this, we're going to switch our trailing and our leading leg. And then I always find this interesting because my ability to like have ease and just relax and sit, like one always feels more comfortable. This is my less comfortable preference, but can I do it? Yes, but there's still a generalized sense of discomfort. And that is okay. We have laterality and asymmetries that are just naturally in every person. It doesn't mean we are dysfunctional. It just means we're a little different right to left. Once we're in this Z sit, maybe you want to choose your more comfortable position, or maybe you want to work in your less comfortable position. You're going to put your arms out like an airplane, if you can. And you're going to just do some rotation, rotate right, rotate left. This rotation is up in the rib cage. You're trying to keep your pelvis and your legs pretty steady. But this is great for all the turning and 20-meter circles, 10-meter circles, and you know, all that rotational control we want to have. And we're getting a rotational hip stretch at the same time. And if you want to work on just some of that side to side strength that we alluded to being so important for prevention of lower back pain, the balance that we're going to test out kind of half kicks in some of our core muscles and half stretches some of our core muscles. So we're going to tip towards our trailing leg. And then we're going to tip towards our leading leg. Tipping towards our leading leg is kind of a workout. It's a strength control challenge. And tipping towards our trailing leg is just a nice stretch. So airplane arms and little side to side tips are just some subtle little changes you can do to these Z-sit stretches that make them kind of multitaskers. The next one we're going to do, we'll be on the ground. We'll be laying on our stomach. That's called being prone. But I'm going to have you guys watch me first because it's hard to watch a screen while you're facing the ground. So you're going to be on your stomach. And you're going to bend your knees and kind of kick your knees out. That's what I mean by froggy leg. So try to get your knees the same width as you roughly would sitting in your saddle, you know, for the width of your horse. So you're going to imagine that width, and then your heels can touch. And then what you're going to do is first just experience what it's like to be in this position. Do I feel the front aspects of my pocket area, so part of your pelvis, the front of your thigh, do they equally push into the table? And you could have, you know, your head down, forehead on your forearms as you assess that. And then I'd want you to practice pushing one pocket into the table or into the floor, and then the other pocket into the floor. So I'm squeezing and using my gluteus maximus to push that pocket into the floor. And then I'll feel how easy is it to do that on the other side. So let's have everybody try it. Knees bent, rolled out the width of your horse, and heels together. And you're going to have your forehead down on your forearms. And then first just feel, do I lay on the ground with the equal amount of pressure on the right front of my pelvis and thigh compared to my left? Or does it feel like one side's kind of hovering off? That might cue you into some hip flexor tightness or some quad tightness, or maybe there's some stiffness on the front of your hip joint. All things that have been covered by the past 3 stretches. And then you're going to actively push. One glute is going to squeeze and push the pocket into the floor compared to the other one. And what I often find is the side that feels tighter for you or is less on the ground, and then you try to push it to the ground, is usually the butt muscle that feels weaker. So I have a tight front of my hip paired with a weak back of my hip. And that's not a healthy tug of war match, right? You have a really tight muscle that's pulling, and then on the other side, it's just kind of a weak muscle going, ugh, I can't do anything about that. So we're going to get into strengthening next. But I also like the idea that sometimes stretching first lessens the tug of war battle, if you will, that gets to occur when you start doing some strengthening. So if I loosen up the front of my body a little bit before my ride, every time then I'm posting and pushing forwards, I might actually have an effort that I can feel. I might actually have softened this just enough that my glute can kick in and my horse can feel that as a better cue to their impulsion. So that is why I start with stretching. But from an injury prevention, global health of a muscle, stretching after the ride is really what's been researched and supported more from the injury prevention side. Questions on any of the stretches? And I still can't find where it has the chat. I had it up and now it's gone. So if Molly's not talking to me, I'm assuming we're going to carry on.
No, is our goal to have both butt cheeks on the floor with that last exercise?
The goal would have been to have both fronts of your pockets here on the floor. Yes, it shouldn't be like one's off the floor and one's on the floor. Both fronts of your thighs should be on the floor. Gently, very gently, softly.
That's in the sits, Z sits. They should both be on the floor.
Oh, yes. For Z sits, yes. For the prone froggy leg, yes, the front of the pockets, and then the butt, both seat bones being on the floor for the Z sits, yes. Maybe with different weights, but certainly both in contact. Okay. We're taking a quick side note up into that lower back. Number one diagnosis people come into physical therapy for is low back pain. We already talked about how prevalent it is in riding in the youth, and it's obviously just keeps at it throughout what we do. We take a very high amount of movement to our L4, 5, and our L5, S1 segments. So right here, right at that belt line. There's so much research on it that there was research done on the research and a meta-analysis. So the highest level of evidence you can possibly have looked at all the research and has clarified that there are 3 generalized types of back pain that I have listed here. The first one is called mechanical low back pain. And it's really interesting because if somebody's hip rotation is over 35 degrees, meaning the hip joint's not really tight, they have decent range of motion, it's a relatively fast onset, and then the lower back vertebrae, so these little guys right in the small of your back are stiff, there's a high chance that within 2 visits, 1, 2, you can have at least 80% reduction of your pain, improved function, It is like whenever those patients would come in, I felt like Wonder Woman, like I could do magic. So it is a really, really great, why I point it out is because it's a really great reason to keep your hip rotation, to keep riding horses where we have all this motion being asked for in our lower back, because it also provides some prevention and protection to our lower back. But let's say, whatever, life happens, your hips get tight, your back gets tight, you're already gaining knowledge to help your hip joints, and just know that physical therapists and chiropractic care is really, really great at treating and helping that lower back mechanically loosen up. You've at least cleared the slate below and you're keeping that piece in place. The second type of lower back pain is just such that most of the younger youth of riding, you know, I'm going to just say 30s and younger, they got all the motion in the world, all the motion in the world in their back, their hips can, you know, let go over their head. They got all the muscle flexibility. But the problem is they move in a way that's a little wonky. Like it's a little, they call it atypical movement patterns, but they kind of have like these weird hitches and these odd strategies. Those are people that don't need to excessively stretch. They don't need to go to the chiropractor all the time. They're the people that actually need to figure out how to coordinate and strengthen at the core and at their pelvis to create more stability. So if you're someone who does all these stretches and you're like, I don't feel anything, you're probably not someone who needs to go back and keep stretching. So in fact, if you kept doing it, it could increase your risk for lower back pain. So for those that are younger and have tons of motion, you're going to care a lot more about the strength we're going to get to next. There's another type of back pain that I am going to bring up just because I'm here and we're talking about it. And that's where you have referred pain that goes down the front of the leg, the side of the leg, the back of the leg, and it gets worse with a directional preference, meaning maybe yours gets worse when you sit a lot and it feels better when you walk. Or yours feels awful as you're up and moving and standing, but it feels better as soon as you sit. Those directional preferences start to give us as therapists clues as to why is there that referred pain. There's most likely pressure on a nerve. It sends its pain down wherever, you know, whatever nerve is getting pushed on determines where you feel the pain. And it tends to then get better with chiropractic and physical therapy, especially in combination. It could be from a disc reason, a disc bulge, it could be arthritis, lots of different mechanical reasons for it. But that is something that you can still do the stretches we just talked about and still do the strengthening we're about to do, but you'll want to have a real kind of slow, keen attention to, is my pelvis a little tipping forwards? Is it tucking under? Maybe I need to do one or the other instead of being neutral for me to be pain-free. So just, again, things that a physical therapist can help customize for you. But there would not be one back pain patient that I've ever met that I didn't spend about 80% of the time working at the pelvis. So again, this is why I bring it up. They're just super, super connected, the back and the pelvis. Okay, now strength. This is, we'll be on the floor for the first couple and then standing for the last two. So I'm going to go to this table if you guys want to head to the ground. And then bridge is a lovely exercise. It emulates the act of posting with the bent knee. So that is why it's so lovely. And then we're going to try doing it with a clam motion. Clams, just in and of themselves, look like this. Feet together, hips stacked, and that knee opens into external rotation. So that's a clam. When I lay on my back and I push up into a bridge, I can then do it one leg out as a clam and then the other out as a clam. So that's what a clam bridge is. Can everyone put their hands on the top of their thighs, right where your pockets would be on a pair of pants? And I want you to push that pocket area up to the sky. That should feel different than pushing your belly up to the sky. And maybe you want to try a little bit of that. Like, what happens if I try to get my belly button as high as I can? And what do I feel working? And then what do I feel happen when I push my thighs to the sky? What do I feel working? And I'm going to point out and I'm going to get a little closer to do it. When you push your belly button to the sky, you tend to feel like your lower back can engage and arch to do that. And when you push your thighs to the sky, you should feel it all in your glutes, gluteus maximus. If you feel it grabbing at the back of your hamstrings, try changing that knee angle a little bit, maybe bend it less, bend it more. But your hamstrings will very often kick in and help if your gluteus maximus is weak. Or maybe you're dehydrated. But for the most part, it's a muscle strategy error. When people push up with their belly, that would be choosing kind of like the wrong book off the shelf. We want you choosing the book where your glutes push your thighs forwards. And it's that same feel that I'll have riders do in standing, where they have their hands here and they just push into their thighs with each imaginary post. And then when we get in the saddle, pushing those thighs forwards towards the horse's ears. Again, this is building that imagery that you're going to need for riding. When you do the clam part, so when one knee opens up, that's where the bridge right to left should stay even. So I put my hands right on my pelvis as I do this. So thighs to the sky, hands on my pelvis as I move one knee out and back. And do I notice my bridge tips, or does it drop down lower as I'm doing this clam? So as you're trying that, thighs to the sky, and then feeling, does that pelvis have a twist when I do a clam with it? And if you're like, easy peasy, this is no problem, then you could progress it by, instead of doing a clam, you just lift that foot off the floor and you do a single leg bridge. And that's when you can really identify how strong is one whole glute complex at keeping that entire pelvic bowl steady. It's a really great challenge. Any questions on that bridge? We're going to roll to our side and then do the side plank or the side bridge, whatever you'd like to call it. So if I'm on my side right now, I have my elbow underneath my shoulder, my two halves of my pelvic bowl stacked right on top of each other, and then my knees in line with my elbow and my hip. So you might have to kind of shift your butt forwards or draw your feet back so that I'm 3 points on the floor: my elbow, my pelvis, and my knees. And as I first just push down into the ground with my elbow, that's getting my shoulder and my neck in a safe place to continue. And for some people, that is just plenty of a workout for their core. You may start to feel shaking on the side of your body, just pushing and depressing that elbow into the ground. And then
we have a quick question here. If you feel your hamstrings taking over, should you stop, or will that help to build glute strength?
You should stop to where you only notice your glutes. So if we're talking about the bridge, I might only rise 1 inch up in my bridge. And then if my hamstrings take over, I'm done. I'm going to go up to the point where I feel my glutes before the hamstrings take over. Because if you keep doing it over and over when your hamstrings take over, you're picking the wrong book off the shelf every time. And adjusting that knee angle. So, in this position, I might tuck my knees and bend them more, or I might bend them less. You know, play around with where your feet are to see if that's a way of taking away some of that hamstring activation. If you feel hamstrings from the moment you lift, you're not ready for bridges. And you got to maybe go back to like that froggy leg position on your stomach where you're just feeling your butt cheeks, and do that a little more. It's a good question. These are humbling experiences of realizing how many times maybe we've been picking the wrong book. So to this side plank, I pushed my elbow in. Maybe that's all I do. And I'm going to do that with normal breathing. Again, there's the whole lecture. And for those that are IDCTA members, go back into the Zoom library and you'll see the breathing lecture. But again, wide, expansive breathing forwards to our sides, soft and relaxed necks. If we can breathe normally, then I might lift my pelvis off the table. And you're going to do that for as long as you can do it without pain and without altered breathing. And then you'll drop back down. You can switch sides and get a comparison about maybe not only how long can I hold, but where do I feel the effort? And here's what's interesting about this exercise. It's the side of our core, yes, but it's also the sides, so the gluteus minimus and the gluteus medius. And in the side plank, the bottom pelvis, so right now my left gluteus medius and minimus are working really hard. And you may say, I don't feel that. Take your bottom knee and push it into the ground harder. And you should start to feel those outer muscles on the downside hip. So these muscles on the side of my hip and the bottom leg as I push that knee into the ground. As I push the elbow into the ground, I really notice my core kick in. But as I push my knees into the ground, it's those outer hips that kick in. It's a fantastic exercise. And actually one that's most supported in the research for activating your outer hip muscles. Any questions on those? Strengtheners so far. Bridges, side planks. Just making sure I'm not missing. Oh. I want to talk about I'll get there later. We're going to finish this slide up. The star drill, favorite exercise. Personal favorite. It's probably professionally a favorite of many therapists, but I'm going to actually slide this out so we can get my feet in here. All right, we're going to stand. For those that need balance support, keep your chair there, your desk there. And we're going to draw a star with one of our feet moving on these 5 different angles. And then when we switch feet and do it on the other side, you'll imagine we're drawing a big star pattern on the floor. So our first reach is going to be straight in front of us. You could touch the ground with your toe. So we call them toe touches. Or you could just hover and really test out the balance of your standing leg. If you can see my hands at the top, really keeping your pelvis level, no twisting, no tipping, super steady pelvis is what makes this such a good hip exercise. So that's reach number 1. Reach number 2 is out and forwards on a 45-degree angle. That should remind you about that TFL muscle we first talked about. Reach number 3 is straight out to the side, working outer hip muscles. Reach number 4 is back and out at a 45-degree angle. And reach number 5 is straight back. I'm going to do a side view of those. So forwards is 1. Forward on the 45 is 2. Straight to the side is 3. Back on the 45 is 4. Straight back is number 5. Keep in mind on 4 and 5 that lower back doesn't start to arch. And 5 is tiny. It's only needing to be 10 degrees. So we are working front of the hip flexors, TFL, gluteus minimus, gluteus medius, and gluteus maximus, all on the moving leg. Meanwhile, the standing leg is working a little bit of everything, but in particular, your gluteus medius and minimus. So that's like minimum 10 muscles at your pelvis that we're working. Your quad is working, your hamstring is working, your calf is working, your foot's really trying to dig in and find balance. So huge, huge multitasker. For those that want to challenge, we are going to do it. You can start to see my hands in the screen now. Oh, let me back up. You can switch feet and do all the same reaches on the other leg as well. But for time's sake, we're going to move on. The star drill with my hands. Now this star is going to be directly in front of me. And I am going to, I'm going to back this up. I'm going to put the star in front of me right here. So I'm going to do those 5 reaches just with my right hand. 1 foot on the ground. And I'm going to reach directly to my left for number 1. 45 degrees forwards to the left for number 2. Straight forwards for number 3. 45 to the right for number 4. And directly to the right for number 5. Now you can see in the side view, I'm just folding. I'm hip hinging. So I'm rotating at my trunk, folding at my waist. This is a huge balance exercise, especially if you can notice as I'm rotating. Do you notice that pivot that's going on at your hip joint? There's a pivot of your pelvis over your thigh. And that type of control is really nice when we're in the saddle and want to keep our feet steady, and we want to be able to pivot our pelvis around these steady lower legs. So when you get into the hand touches, you're really starting to challenge all the rotational muscles at that ball and socket joint. When you're doing the toe touches, you're working, hip flexors and all the kind of I guess the meat, if you will, the meaty muscles of your pelvis, the bigger ones. And then the hand touches are starting to work some of the real tiny ones that are under that pelvic floor and between your seat bones and your tailbones. They're really deep and up and in that pelvis. Any questions on those? Yes, they are balance exercises, but I love them most for their hip strength capacity. You can get pretty tired pretty quickly. I would do them to fatigue on one side, to fatigue on the other, and then go 3 times to fatigue total. So an endurance exercise. When you do the star drill too, the forward activations that you have are nice for when we start to want to bring that leg forwards and influence the horse's shoulder. The reaching behind us starts to give us strength for taking our leg back and working on the horse's haunches. So that's the riding reason why I love that exercise as well. Okay. Hip balance. We're going to do these fairly quickly. But the overall idea of why we use balance is because we want to be following riders. And I love this because it's stuff that I wish I did when I was a younger rider. I did a lot of bareback riding and lunge line lessons and no stirrups, but like this right here is where you really capitalize on the fearless nature of the youth, and they're developing really great balance. So they can be super fluid and following versus more strength gripping. So this young lady is doing some tall kneeling. It is a position that I like because when we ride, we have our feet in the stirrups. We have a little input from our feet, but for the most part, we're trying to have our friction and our most active part of our body coming from our inner thighs, kind of knees up. So if we are in tall kneeling, we're not able to use our feet to really grip and be tense in any of these balance exercises. When you tall kneel and do them, you're really demanding that the pelvis show up and do most of the balancing work. So let's try this. Tall kneeling. For those who don't want to do tall kneeling, put your feet close together in standing, or put them like heel to toe. And you can still do these things. But tall kneeling is great because it just takes your feet out of the picture and you get only the hip benefit. So we're in tall kneeling. Just being here is a workout. So pelvis level, pushing our thighs forwards. And then you're going to have your arms out like an airplane. And you're going to rotate. And this rotation, you should try to keep your pelvis pretty steady. I don't want our pelvis twisting along because it's truly meant to be about pelvis steady and rib cage rotate. If you can do this with reasonable balance, you can close your eyes and try it. You could put a kettlebell or a hand weight in your, or the free weight of like 10 or 15 pounds in your hands as you do this. And now you'll start to feel your butt muscles really have to kick in the whole time. But even as we're doing this, you should start to feel some of your little tushy muscles, just tiny little activations as you do the rotation. So for example, when I rotate right with my trunk, my left butt cheek is a little more firm. And when I rotate left, then the right is a little bit more firm. So this is cool because when I'm in the saddle and I want my horse and I'm tracking right and I'm doing a 20-meter circle, my left butt cheek is closing in on the saddle. It's facilitating a turn magically. I don't have to apply any of these as like a leg aid. Just as I rotate, I now have this ingrained behavior of when I rotate and keep my pelvis steady, or maybe following on the track of the circle, I'm doing that with some left glute initiation, a little bit of squeeze. So that's what I like about this exercise is it's coordinating your rotation of your trunk with tiny little stabilizers at the pelvis. If you stand on one leg with any other types of exercises you do, like let's say you do rows or you do bicep curls, or maybe you want to stand on one leg and pull a band and do some twisting. Anytime you're on one leg, that standing leg is getting an outer hip workout. And if you're like, well, I don't work out, that's okay. You can stand on one leg as you put your helmet on. You can stand on one leg as you put your gloves on. You could stand on one leg as you're making your horse be patient at the mounting block. So just trying to find other ways to put that into your activity as a way to sort of wake up and fire up that outer hip as you get on the horse and then put it to work. Scissor hops. These last two are kind of for some higher level balance. So do them if you want, or just watch. Scissor hops, you're going to be in a staggered foot position. You're going to soften your knees and you're going to just switch to the other position. And then you kind of just keep switching as you go. What I like about this is shock absorption. I'm learning how to decelerate myself as I come to the ground. And in posting the trot, as I come up and down and up and down, I need that down to happen with control. So I'm practicing some of that deceleration from my butt and my thighs that will help me decelerate down into the saddle. Then side to side, skater hops are just doing little hops. They can be like really big, giant ones, like it implies, like you're a speed skater, or they can be just little hops to the side. My side core, side hips, and sides of my ankles are working quite hard, and they're doing so in somewhat of a non-predictable way, meaning I don't land the exact same way every single time. So I'm getting used to receiving information up my body and having to work at it to control it at my pelvis. So receiving that balance and movement of the horse, and then the outsides of me can stabilize. So those are just side to side hops. And from this view, let me make sure my knee's in here. I want that knee, the landing knee, to stay fairly close to that line of the toe or back. And notice I'm sitting. I'm not doing this and having that knee bending forwards in front of my toe. When I land, I sit. 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 So just being aware of that. When we shock absorb with your hips, not with your knees. Okay, tall kneeling trunk rotations, single leg balance, those hop exercises, receiving some kind of dynamic differences of how we land is part of practicing balance as we receive movement from the horse. Questions on that? I got my heart rate up doing my skater hops. All right. We're going to go into some combined ideas. And then at the next slide is all the ways we integrate it into riding. And then we're coming to close. So chopping. So the movement of chopping, think like I'm chopping wood, right? Across my body. When we do that, so we can stand or sit if you like. But when I take my axe and I'm getting ready to swing, my pelvis is pivoting. This thigh, the high side thigh, is fully internally rotated. And the trailing side, the low side, is fully externally rotated. And then when I chop down, it's the opposite. This side's fully internally rotated and this side's fully externally rotated. So if you didn't follow it, that's okay. Point being, I'm moving my pelvis or the socket around the ball. All the other stuff we were doing was moving the ball in the socket. This is a stable ball and a moving socket. When I have my legs in the stirrup, they're stable and my pelvis rotates on that. So chopping is starting to use our rotational motion, very close to how we would do it when we move and turn our pelvis for turning cues. So you could take that chopping motion and put a band up high in a door and pull down. You could shut a band down or step on a band with your foot and chop low to high and get some pulling. Both versions are going to be very core and hip focused. So those chops, I think, are really, really nice for practicing moving the pelvis on the socket. The bridges, I'm going to dovetail this into the pelvic floor just real quick. When you do a bridge, and honestly, when you do any type of glute strength, hip strength, It's really common people hold their breath, which also would hold tension in their pelvic floor. For all the reasons we'll talk about next class that we do, that is not helpful for a horse to want to move and lift up into you and, oh, this nice following rider. If you have a rigid pelvic floor, it's very tense on the saddle, and horses feel that and can hollow out because of it, or at least just not be as invited to come up. So when you do a bridge or anything we've done today, try to think about when you take an inhale, your pelvic floor coming down, lowering, like a balloon filling with air. That pelvic floor will give as your abdomen fills with air on inhale. And then when you exhale, that pelvic floor comes back up. It helps push the air out through your mouth. So you could, if you wanted to try this just sitting, breathing, having your pelvic floor lower into the chair, and exhale and kind of push your air out forcibly, and you'll feel that pelvic floor lift. And if you don't, come to the next class because we're going to get really specific about that. But that is a really important combination idea, is that anything we do strength-wise is also paired with receiving and having some flexibility and ease at our pelvic floor. Because if we're rigid in our pelvic floor, we don't feel that horse's back movement or rib cage movement quite as easily. The greatest stretch in the world. I didn't name that. That is, if you Google the greatest stretch in the world, this is what comes up. It's just a really cool combination idea of being in that lunge stretch. And then we're going to take our little airplane arms, and you're going to take whatever hand you want first. It doesn't matter. And you're going to touch down to the inside shin of your leading leg. Maybe you have the balance and the flexibility to touch just to the inside of the knee. And if you can see, my other hand is up in the air, like I'm turning my airplane. Ooh. If you have a lot of flexibility and a lot of balance, you can go all the way down and touch the inside of your shoe. You can touch anywhere along between the knee and the shoe, however much you feel capable of doing. So, stretched pelvic tilt tucked. I feel my stretch here. And then I'm going to let go of that stretch for the sake of turning and touching my inner shin. I will do that with both arms. And you will notice one side is vastly easier than the other side, because one side is actually just stretching your joints. And then this side is stretching a whole bunch of soft tissue that wraps around your torso and your rib cage. So different stretches on purpose, which means we will have to do that with our feet in this swapped position. So inner shin, whatever depth you want to do. And then you're going to switch to the other side. The greatest stretch in the world. Bretzel and Bretzel 2.0. This is taking the word pretzel, a pretzel stretch, and reminding us that we're going to breathe during it. So they're called Bretzels. I have both here. And in their pure setup, if you see the Bretzel, like you would use a pillow and instead of those two blue foam pads. And this also will let you guys decide how much you want to try it right now. You need a certain amount of flexibility, but it is a phenomenal stretch. The Bretzel stretches the front of your hip flexors, the front of your quads, and it gives you a rib cage stretch. The Bretzel 2.0 stretches all the backside muscles, such as like your glutes, your piriformis, your lower back muscles. So the front stretch and the back stretch, if you do both versions, are really, really nice. The Bretzel, the guy with the blue pillows, when you do this, your bottom leg goes behind you. And your top leg for us, because we don't have pillows here, will just lay in front of us. And you're going to take your top arm and go back and try to reach that back foot. And I encourage you guys to lay your head down and even look back a little bit. It'll help with your breathing feeling a little more even. And the breathing is what adds to the stretch quite a bit. So maybe 2 or 3 deep breaths. And then you would take your bottom leg, swing it to the front. Top leg just flops to the floor. And I kind of think of it like you're going to go into a plank position. And now you're getting a nice stretch of your bottom leg butt muscles. So your gluteus maximus, your piriformis. And then you'll feel it kind of down in the lower back and up into the rib cage as well. So just nice positions to sit and take 2 or 3 deep breaths in. You would then flip and do the whole reverse, comparing where I feel the stretch, how strong is the stretch. Maybe one direction I can feel a really nice full deep breath and the other it's hard to breathe. Those would be some comparisons you could do. Okay. Last slide. Sticking this, almost last slide. Things, if you experienced during today, or as you do some of these, that I would want you to stop, time out, and touch base with myself or a physical therapist you work with. Other hip things maybe you already are experiencing that should be talked about. Catching and locking. That's a little bit different than just a pinch. Catching is like every time I do this, there's this as I do it. Locking is I feel a distinct like locking up of that hip, and I can't unlock it without a lot of discomfort or several steps, especially with getting up from standing and squatting or pivoting as you're like working, let's say in the kitchen. Getting on a horse is usually where I see people where if they do have some hip arthritis or some soft tissue damage within the joint, those are the types of catching and locking moments that I'll experience with riders. Radiating pain down the leg, like I alluded to, it can come from the lower back. It can also be hip joint tightness. Either way, that's pretty inflamed, irritated tissue by that point. And I'd want you to have some follow-up or touching base with a PT or chiropractor before doing these exercises continually. Pain that persists for over 2 weeks, if you pulled a muscle, overworked something, it happens. But beyond that 2-week mark, you're starting to write a lot of bad books. So it may still get better by itself, but in the meantime, we got to make sure you don't keep reading those bad books. And that's where physical therapy helps substantially. Massage, acupuncture, all that other stuff can come into play too. And then the big thing is if you hurt yourself, you fall off, whatever happens, if you can't put weight on your leg, that's, skip the conservative stuff, skip the physical therapist and go right to urgent care if you can't put weight. Integrating into riding, I'm going to tell you that a vast majority of what we've learned today sets the stage for you to just enjoy the riding you're currently doing with greater ease. But when I work with clients, this is where I really can start to teach them how riding can become the workout so that they don't have to do all the things off the horse. All the things off the horse need to be done when you're learning and getting used to these motions, kind of getting things stronger for the first time. And then eventually, if you're riding regularly and correctly, the riding becomes another aspect of your workout. So we use hip flexion with posting, getting into our 2-point, bringing your leg up into the stirrup. So hip flexion is done pretty repetitively, and I don't see too much limitation in like the strength for hip flexion. But if you have an inability to fold forwards in your 2-point, I do see some stiffness coming into play with some jumping position work. hip extension going behind us is part of that ability. If we can't fully bring that leg behind us, we don't get full engagement of our glutes. It was that uneven tug of war. So when I post up out of the saddle, if I know to push my thighs forwards and I've stretched my hip flexors a little bit, I'm going to get a really nice activation of my glutes, and the horse feels that. And all of a sudden they're participating more with their glutes, and I'm not squeezing or using, spurs or a whip. I now have just a better butt to butt connection from my glutes to the horse. So bridges are where we practice that off the horse, and then the posting up is where you're going to integrate that into your riding. Internal rotation. When I want to close the door for my horse's shoulder and open up their space for their haunches to move, I would use my leg with an internal rotation. So I'm riding and I would just internally rotate. So let's say I want to do haunches to the right. That's how I would set this up. And if I want to do haunches left and not have their shoulder move, internally rotate. And that feels a little counterintuitive. I'm not pinching my knees. I'm not pinching in. I'm internally rotating. Technically, my knee doesn't get any more into the saddle with pressure. A different part of my thigh will lay on the saddle. When we internally rotate, we are also opening up the space and stretching the muscles between our two seat bones. So we are able to more fully sit on these convex saddles. So the right to left view of that saddle. So for people that tend to ride in more external rotation, so if we like squeeze our butt cheeks together and get open, that's not a very soft set of butt muscles, and that's a very tense place on the horse's back. So a little internal rotation sort of lets your glutes soften and open and widen, and you have a more following seat. I do think external rotation is helpful when I want to invite my horse's shoulder right or invite my horse's shoulder left. And I do think when people start to do lateral work, if they're doing all this like pushing and pushing and pushing and pushing for the lateral work, but you have this pinched or turned in thigh, you're shutting the door for the shoulder. So we have to make sure that the direction we're doing lateral work towards, it's an inviting open inner thigh. I don't have to take my leg off, but I can externally rotate it. Kind of a fun little snippet of the type of things that when I do in-person work, we then go and integrate these things and put them into action in the saddle. I want to point out one last study at this time, and that was done by Hillary Clayton, and she's a phenomenal resource for research. She does a ton of it. And they did some work with 20 experienced riders. They had them sit on a yoga ball and had them move the ball side to side. So side to side. And then they also had them practice lifting one arm, lifting one leg, and seeing how steady they could keep the ball. So that side to side movement of the pelvis, doing it evenly and in control. They had a bunch of physical therapists watch, but the ability for them to do that really highlighted the kind of the skill and the technique appropriate for the horse to not only, this is great research, they had fewer behavioral issues, just overt evasion of the aids or misbehaviors in doing the riding movements, but they're also able to have a higher heart rate, meaning the horse was able to participate at a more vigorous, higher impulsion type activity. So what I like about this study is we're starting to really connect that if a rider off the horse has an ability to smoothly move, evenly move from the right to left side, which takes flexibility, balance, strength, and coordination, we objectively can see that the horse can perform better. So I'm excited by it because it's starting to become research that's backing up the work we all spent some time with tonight. But I do, for those that want to Google Hillary Clayton, she has a bunch of research that's doing quite a bit of work on the exercises and performance that a rider needs to have for the horse to perform better. So I'm going to skip to this next slide. It has in tiny font on the bottom some of the studies we went through today. All kinds of research is there. These are just some we applied for today for the hips, but please also continue to use me as a resource, whether that's just about this material, something specific that you have as your own question, excuse me. And I really hope you join us for the remainder of the 3 other talks we have this month. With that, we are at 8:59. I can stay for a little bit and answer questions that you guys have off of the back half or the total lecture together. And you can just unmute because I still can't find my chat box.
I just want to thank you for this very informative, just very applicable set of exercises and the way they relate to the horse. I've been having a little trouble with my horse, and this has been, I'm going to be putting some things to work tomorrow. So thank you.
It's a lot of information. And if you guys need, go back, follow the recording and go refresh yourself because it is very content dense.
Yeah.
So,
Thank you are there any final questions before we end?
I
tonight?
do. I have a couple. So if you're looking at the external rotation of the hip, so would you be using that like for a shoulder in or half pass?
Very much, yes. So I would, let's say I'm going to do a half pass to the right.
Mhm.
I would internally rotate my right leg, saying, slow down right shoulder, open door right haunches, come on. And then I might also externally rotate my left leg, which is saying to the left haunches, engage, go, push.
So sometimes I don't get enough crossing in front. So in that case, I would want to use an external rotation instead to make room for that shoulder to move.
Yes.
Okay.
Yes.
So then the reverse in like in haunches in,
Mhm.
that's one place where you would use the internal
On the inside.
rotation.
Yes.
Okay.
Yeah. Yeah, that's sharp. That's great. And it's
Okay.
and I'm just gonna, again, it's not an in or out experience. I think a lot of people lift their leg away from the saddle to make space. And that's very disruptive and that's a lot of hard work. So just these little swivels, all of a sudden are making space in a way that we don't have to actually like lift the leg away from the saddle at all. It's great.
Mhm. Okay, that's very helpful. Thank you. It's a very good lecture. Thank you.
Thank you.
I also want to tell you all that there will be an in-person clinic on the 22nd of April. So the information will be coming out shortly on that. I'm getting the final flyer together so that we can start letting people know what it's going to be about. So again, thank you so much. And we'll see you next week.
Thank you guys.
Yeah, thank you so much. Bye.